It's Door County's own FM 106.9 and 93.3 The Lodge in Studio B. It's Wednesday, and that means Dr. Heise, our favorite local doctor. How are you today?
I'm great, Jamie. How are you?
Real good. Nice and sunny out and feeling more like summer every day. I feel like we have some hopeful news. And then I turn on the news, and as much as we feel like we're kind of lulled into the sense that COVID's over, it's not.
No, unfortunately not. I mean, that's the thing is we'd love it to be over. I even find myself with the nice weather and things had quieted down at the hospital, and we don't use that word in medicine, quiet, but I just used it. Things had quieted down, and then, the positives don't stop. We don't have a lot, but we had 2 or 3 more, I think, since last we spoke.
Sure, yep.
And we have a few more hospitalizations, so it's not over, and it's going to be a while before it's over, but I think this is sort of, again, I hate the term new normal, but I think this is sort of
do it.
Yeah, I think this is for now anyway, a temporary new normal where we're going to see occasionally patients roll into the hospital and they're ill and hopefully they recover and go home. But to think that this is all over with and done is probably not right.
No, and obviously with the national news too, that we're seeing a lot of outbreaks in what I call the hot states, and not just hot because there's a lot of tests, but they're hot. It's like 111 in Phoenix.
Right.
So
Climate hot,
I always feel like that's the reverse winter, right? They're going inside to stay inside and stay in air conditioning, whereas we would go inside to stay in warmth, right? Mm-hmm. So you're having more confined spaces and more people, more density. And I think that's an interesting uptick in the national numbers as well.
Yeah, I mean, that is the interesting piece. And, people that for political reasons or whatever argue, well, making people stay at home and making them quarantine is the exact opposite of what you should do. The way it was posed, at least around here, was incorrect. But I understand where they're coming from because what you said is exactly right. It's, it seems like if you can get out into the open spaces and have there be good space in between people and that sort of thing, that seems to be the key. Whereas if you go in and you're in closed spaces, I think you can at least put that connection together because, if you think about a lot of these bars and areas, I heard there was an outbreak or at least an uptick in Green Bay because people were in bars without masks and together. I mean, that's one of the things that this virus, quote unquote, loves is close contact, easy respiratory transmission from person to person. And the virus, if nothing else, has shown a real propensity for being infectious and keeping itself going. Any living organism, in order to survive as a species or as an organism, wants to propagate itself.
Right.
And it's finding ways to do that.
The little devil's persistent.
Yep.
And let's talk a little bit then about our local numbers and what's happening regionally. So the Department of Health, I guess it's the State Department of Health, has a new sort of ranking system. Like if you go to their website, it's really nice because they've kind of switched gears. Instead of just looking at numbers, they're giving us your county is high, medium, or low. And then they'll give you, are you static on a downtrend or an uptrend? So we have this sort of nice, what is it relative to everything else, instead of just trying to count the numbers and be real quantitative. And I think it makes more practical sense. So Northeast region right now is considered high, even though Door County is low.
Right.
And I think because of the outbreak in Brown County. So what I've heard for that is there was people out mostly around Washington Street or in bars, had done some bar hopping, and that spread it. So we still need to be cautious.
Absolutely. And it goes back to I've been kind of harping on it because I think it's simple, which is the 3 things that we can do to really keep us in good stead, I suppose is a way to say it, is wear your mask when you're with other people and like in grocery stores and things like that. Wash your hands frequently and physically distance yourself. If you can do those 3 things, and masking this has become this huge political thing, and it escapes me how this has happened. And I know the whole liberty versus tyranny thing, but really we're not talking about wearing masks forever and all the time. What we're talking about is I want to go to the grocery store and I want to pick up some groceries. You know what? Wear your mask when you go in the grocery store. Get your groceries. Go home. Take off your mask. Wash your hands. In fact, take your mask off when you get back in the car. You don't need to wear it in the car.
Right.
If you're going to be outside walking on a trail, you don't have to wear a mask. I think if we just did those 3 things, we could get back to at least as close to real life or normal as we're used to.
How do you feel about the masks and the outbreaks while I feel like we're somewhat isolated leading into the July 4th holiday? Tourism in Door County, big thing. There's a group of folks that I feel are watchdogs of businesses. What I've been noticing is there are a lot more people and a lot more people bringing their toys along with them. Bikes, paddle boards, kayaks, doing a lot more outdoor activity.
Yeah, I think the way to go is positive reinforcement as far as wearing masks, and for those groups that are watchdogging that, so to speak, I think being positive about it and saying, hey, way to go. I think the negative shaming doesn't really help. But I think that's a big question I get on Facebook Lives and things like that. People really want to know about the positives that we report for Door County. How do we know that that doesn't include people from Chicago? Well, we know it doesn't because people's testing is attributed to the county that they live in. So we don't know if someone's coming up with COVID. You assume that if someone's sick, they're not going to be traveling. But the thing is that whole asymptomatic thing. So again, I'm going to harp on it one more time. When we're wearing the masks, we're not wearing the masks because we're afraid to get it ourselves. We're wearing the mask because what if I have it and I'm asymptomatic of it? I don't want to give it to someone else. I know that seems kind of different or backward from what we originally said about masks, and it totally is a 180, but I do think the big issue is, me personally, taking care of COVID patients, I don't want to give it to my friends or whatever. My spouse is at risk, and I wash my hands and I'm very confident in that, but I don't want to spread it to anybody.
Right, and obviously it's not a hoax. You'll still hear some people that are using the masks as I'm not afraid, or like you said, a political stance, because you've literally taken care of the people. Yeah, no, it's not a hoax. I mean, I sort of laugh at that, and it is one of those things when you're in the thick of it yourself. This is one of the first times in my life that I'm in the middle of a quote-unquote political issue or something, and I'm able to hear things from the White House or from wherever, and I can say that's just flat out not true. I know what truth is because I live it. Right. And it's been really, really interesting. And challenging, I imagine, too, at times, trying to control the message. It can be maddening, but I really do believe that we all are trying to do the best that we can. Maybe not all politicians in Washington are, but I don't know any of them, so what can I say? And or they're removed from what we're doing here locally, too. Right. We're speaking with Dr. Heise, Door County Medical Center's Chief Medical Officer. A couple days ago, the Department of Public Instruction has now rolled out some guidance on going back to school this fall. And one of the things that they're doing is kind of continuing with the Badger Bounce Back program, at least here locally, on giving that guidance. We're looking at maybe a 4 days of school per week, or a 2-day rotation was a recommendation. Have you been speaking with any of the superintendents here locally? Are we working on that here locally, or is that really fresh? It's just rolled out. It's pretty fresh. If I understand correctly, I believe we are going to be helping in whatever way we can as far as the school districts are concerned. I know one of our physicians, Dr. Amy Fogarty, has been meeting with the school districts to try and help from a medical perspective. So it's going to be tough for them to come up with the right mix and the right steps to take. But I think my personal opinion is, I think if we can do our best to get kids back in school, I think that would be a really good thing. I think everyone really wants to have their children back in school, not only from the education standpoint, but from the economic standpoint, too, of not every parent can stay at home with their children or can be that in-home teacher. I think in general, if you've never thought about how interconnected things are, this has really been thrown in our face with this whole pandemic, is you realize that if I make a decision to do X, that affects 5 downstream things. And so we say, well, keep kids home like a snow day. Well, it's usually 1 day. We don't think much of it. Well, now we're going to close school for 3 months. Oh my gosh, what are we going to do about the kids and staying home and all these different things? And so the downstream effects are as important, really, as the pandemic. So as a parent, should I be planning on buying some back-to-school masks to send my kids to school with this season? Yeah, I do think that masking is going to be a big component because, again, it goes back to that triumvirate, those top 3, wearing a mask, physically distancing, and washing your hands. That's not going to go away. I have no idea how we're going to keep our kids physically distanced. They're huggers. They're all jovial and messing around in the halls, or you have younger kids that are coughing and sneezing on each other because they're first graders. Those are the tough questions that have to be answered. But I guess from my perspective, from a medical perspective, unless, even though, yes, you're hearing that kids can be affected, and that's true, but I think what we're seeing is not a lot of hugely serious effects. There are some, but generally speaking, so I'm less worried about the kids giving it to themselves. I mean, at least getting together and being close. I'm more worried about would they have it or would they get it from someone else, and would they then give it to a parent or a grandparent that maybe has medical problems. And so it's tough. Any other positive notes on the COVID-19 as we kind of progress into our first sort of big holiday? Well, I guess every week that goes by that we don't have a huge uptick in numbers, I take that as a positive. The concern always is, of course, when you get tourists who we welcome, at least I do. We're a tourist economy in a tourist area. I think it's great to have tourists around, but it's always a risk when you're in closed spaces. Is there going to be an uptick in cases? And so every day, every week that goes by that we don't see that, we'll take that as a positive.
positive. That doesn't mean that we can let our guard down, though. I think we have to be careful, and I know I keep harping on it like a broken record. Wear that mask, physically distance, and wash your hands. I think there are 3 simple things we can do, and we can go on with our lives and not have upticks in cases.
We're with Dr. Heise, Door County Medical Center's Chief Medical Officer. Thank you again for stopping in this week.
Thank you, Jamie.